I'm Joan Follick, Clinical Lead for Day Services at Grove House, which is part of Brelly Grove Hospice Care in St Albans. And we were fortunate enough earlier on this year that Emma Holly approached us to offer her services. The feedback has been absolutely fantastic. It is a unique service. It is not offered anywhere else, to my knowledge, in the area. And people are surprised to be offered this type of treatment and are overwhelmed by the success of it. They have fed back that the scars have much improved pain-wise, tightness-wise, and as a side effect, it's even looked better. We're lucky here at Grove House. We're in the grounds of the City Hospital, St Albans City Hospital, and we work very, very closely with the breast clinic, and we have developed a very good relationship with them, and Emma is able to offer this treatment to a lot of the patients there. So it really has been a partnership working and very, very worthwhile.
I didn't know anything about ScarWork Therapy until I went to a day centre who provide services for people with cancer, and they told me about it, and I thought it's worth a try, because at that time everything felt so sore, so sensitive. On my first treatment I didn't think it would do anything, I have to say, and I came with this most enormous pain that had been in my front for the last 6 weeks, and it was like all the nerve endings were just crying out because they'd been cut. And I walked away after the first treatment, and it had reduced to a stage where it didn't worry me anymore, and I just couldn't believe that it had done that in one treatment. I've got a double mastectomy, and the scars are this way, and at the front of my chest was so tight that it restricted any movement that I made. I didn't think at the time about skin moving would make the difference, but actually all my skin is now moving, which means that my arms are now moving, and that's the difference it's made. I've got full movement back. I don't go to the physio anymore, and that's all down to this massage.
Developed a very heavy scar tissue just above the incision scar, and it's very lumpy and very hard and quite big and elongated, about 3 inches long. So I've discovered Emma Holly and came along to see her. I've seen her twice now. And the result is that after her manipulation, I noticed the first time round my scarring was tapering off towards the end, becoming much softer, and the main part of it, which was quite a heavy sort of 1/4 of an inch, 1/2 inch thickness, has softened up, and it also seems to have disconnected from part of the breast which seemed to be sort of stuck together. So what she's done is freed up the actual scar tissue from some breast tissue, and just made it a lot softer. It's not quite so painful when I wear a bra, and hopefully, you know, we're going to keep going with that, and everything will be, you know, it will disappear, but it's much more comfortable. So you know, that's what I could say. Also, because I had some cording under my arm, I'm currently having physiotherapy at my local hospital. And the lady there did start to try and dispel the scar tissue, but she wasn't having terribly much success, and it was quite painful at that time, so she's given up on that, and she's said, you know, I've seen her and I said, you know, that I'm going to see Emma, and she's felt it herself even just last week, and she said it's, you know, really improved. And she's very glad that I found a person that can help me.
I had scar tissue massage after I'd had surgery, and it made a big difference very quickly.
Yeah.
But my arm tightened up again after radiotherapy, and I came back for more treatment after that. It's definitely helped in terms of getting some flexibility and suppleness back into my arm after I'd had surgery. It's made my arm feel far less tender and given me much more freedom in movement.
So how's everything felt since you started treatment? What's the changes been?
It's been a vast improvement. I felt really, say, comfortable, and it's helped me a great deal. I'm really, really happy with the result.
And how would you describe your scar to begin with? What was the issue?
It was very puckered, my scar. The main scarf after mastectomy was quite good, but I had a lot of puckering and it was uncomfortable where my bra was. So that was one of the main reasons that, I wanted to have some therapy.
And how quickly would you say it improved?
Certainly after, I think, the second treatment that I had, it improved a great deal. And I'm now on my last one, or hopefully, and yes, it's really, really good.
But having recently had a diep, I was experiencing some discomfort, and I was recommended to try scar therapy. Very, very tentatively at first because my stomach was very, very swollen, very tense, and didn't like the idea initially of being touched. But over the months that I have been coming, it's getting easier and easier. Before, we could literally just about run some fingers across almost like a feather, and now we're able to go deep down into the tissue. And from having started at 9, looking like I was 9 months pregnant, and now the manipulation of the tissue and the muscles all around there, I only feel about 2 months pregnant now, so it's all positive.
At the end of the session?
Well, at the very beginning of the session I was in great pain all over my shoulders, my hands, everywhere, and I just felt very uncomfortable basically. It felt like I had a rock in my chest, and when I finished the session, the area was much softer and I'd actually come to life. It felt warm and smooth rather than rocky and hard.
I would like to say that Emma has her own business, but she volunteers for Grove House and offers her services free, so therefore there's no charge for patients either.